When Matt Hancock said on the 15th of March, we have a plan, herd immunity is not part of it, was that wrong?
Yes, and saying it's not part of it is completely wrong. I think there's a sort of semantic problem now that, and I look back through all of our WhatsApps between me and the Prime Minister and Hancock and Chris Vallance and whatnot. Essentially, there's a sort of semantic question about, is the goal herd immunity? Do we want herd immunity? Versus, is that the basic plan? Of course, no one wants this to happen. No one wanted any of it to happen. But the point was, herd immunity was regarded as an unavoidable fact. It was the only question that we practically had was one of timing. So, I mean, we can go through the chronology of it, but after some SAGE members said on the 11th publicly, well, you know, we're going to be shielding people, and then by the time they come out of shielding, the rest of the population will have herd immunity. That was the plan. I'm completely baffled as to why Number 10 is trying to deny that, because that was the official plan. You can see it in the COBRA documents that I brought along. Hancock himself and the chief scientist and the chief medical officer were all briefing senior journalists during the week of the 9th. This is what the official plan is.
So let me ask you about the SAGE meeting on the 5th of March, which the minutes say you were at. Now, at that point on the 5th of March, it was 5 weeks since the WHO had said COVID was a public health emergency of international concern, and countries like China, Taiwan, Korea, even Australia and New Zealand were starting to lock their borders down, set up test and trace programs, stop mass events. But the minutes of that 5th of March meeting say that the only measures recommended were shielding the vulnerable and elderly. At that point, on the 5th of March, did you advise the Prime Minister that SAGE was wrong?
No, I didn't. So I was ringing increasing alarm bells in the first half of March, but I had a sort of my thought process was, so I started getting people coming to me around about the 25th of February saying, very smart people saying to me, America is completely screwing this up. You should be really aggressive. Don't listen to all these people saying that, you know, there's no alternative to this. I personally am starting to take preparations. I'm buying things. We're going to have to lock down, etc., etc. But the official view all the way through the first half of March and actually into the week of the 16th of March was that would all be more dangerous. Now, my mindset was, I was really torn about the whole thing, because in the first 10 days of March, I was increasingly being told by people, I think this is going wrong. But I was also really, really worried about kind of like smashing my hand down on a massive button marked, ditch the official plan, stop listening to the official plan. I think that there's something going wrong. Now, I did do that, as we'll come on to, but around about the 5th, I was still reluctant to do that, and we were exploring lots of different things that were going on.
So just to be clear, that was 2 weeks before the Champions League event in Liverpool, the Cheltenham Gold Cup.
Yes.
And you didn't, at that point, advise that those mass participation sports events should be cancelled?
No. And in fact, our official advice at the time was, and this shows the kind of logic at play, the official advice at the time was, doing that, A, won't really make much difference to transmission, which seems obviously bizarre in retrospect, the idea that we would keep having mass events going on through this whole thing. But also, secondly, it could be actively bad because you'll just push people into pubs. And of course, no one in the kind of official system in Department of Health drew the obvious logical conclusion, which was, well, shouldn't we be shutting all the pubs as well? The kind of, at this point, round about the 5th, the logic was, oh yeah, well, obviously, given we're not going to be closing pubs and closing retail and closing leisure and all of this, then I sort of see the point of the official advice. Because if you're not going to do those things, it does have a logic to it. Now, of course, the logic itself was completely flawed, but that's what the thinking was around the 5th of March.
So let's talk about the weekend when the plan did change. So this morning you tweeted a picture of a whiteboard from the Prime Minister's study of what you call Plan B, and you said you showed that to him on the morning of Saturday the 14th of March.
Yeah.
Was that the moment that you told him for the first time that the scientific consensus, as we saw in those earlier SAGE meetings, was wrong?
No, it wasn't the first time. So the data scientist Ben Warner was working in number 10. His brother, coincidentally and thankfully, was working with the NHS to help the NHS with building a whole data system and data dashboard to deal with COVID. He came to me on the 7th of March, and he had been in various meetings about the official plan. And he said to me, I'm really, really worried about this. It seems to me that people, this plan could easily be mad. It could be incredibly destructive. Like, has this really been tested? Have you really thought it all through? Should I and some others start thinking about Plan B?
But when did you tell the Prime Minister that we needed to change direction?
So on the morning of the 12th,
right.
I said, there's all sorts of different things.
But the morning of the 12th, that's a Thursday, wasn't it? That was the first time you told the Prime Minister the scientific consensus is wrong, we need a Plan B.
So on the night of the 11th, I texted the group with the Prime Minister and the Chief Scientific Advisor, and I said, people can see the trajectory and how social distancing will be needed to flatten the curve. Very sensible people, including former CDC officials, etc., and doctors are saying the risks of delay are much, much higher than the risks of going too soon. If we're not going to say tomorrow, starting social distancing today, we're waiting, and effectively just keep telling people to wash hands, there's going to be massive pushback saying, why wait 5 days? Why not move now? Why not flatten earlier? Proposing tomorrow that we delay action until next week will require extremely clear justification with supporting data, models, etc. We'd have to make it public for global scrutiny. So this is on the night of the 11th.